This video is for the males and penis owners who are struggling with pain or discomfort in the pelvis. And the pelvis includes the perineum, the penis, the anus and the rectum, the bladder, the urethra, the testicles, the scrotum, or even the buttocks, hips, and lower back. Does your pain flare with activities like prolonged sitting, defecating, or sexual intercourse? Your pelvic floor muscles may be the culprit. In fact, 1 in 10 males under the age of 40 have high-tone pelvic floor disorders, simply meaning their muscles down there are tight. Have you received negative test results from your doctor for infection? Your pelvic floor muscles may be mimicking signs of infections like prostatitis, UTIs, or even STIs, and these muscles are simply trying to tell you that they're tight. And your pelvic nerves may even be irritated by these tight muscles, sending shooting, stabbing pains throughout the area of your pelvis. In fact, 97% of penis owners who visit their urologist for pelvic pain actually just have pelvic floor muscle dysfunction. My name is Melissa, and I'm here to help you understand the role that your pelvic floor muscles play in your pelvic pain, to offer therapeutic yoga as an option for how to alleviate this muscular tension in your pelvis and ultimately help you recover from your pain. And I'll do this by demonstrating 2 10-minute yoga flows with the help of my partner, Rob. Rob and I will show you 2 different yoga flows, one on your back and one on your knees, to help to open up through the hips and the groin. For props that you'll need during our second flow on our knees, bring along a towel or a yoga blanket and a stable chair. First, let's talk anatomy. So here I have a male pelvis model, and you can see here we've got our hip crests, our pubic bone, and our 2 sit bones. And if we look at the bottom of the pelvis, the place where we sit on chairs, we can see the pelvic floor muscles. And if we're looking at this more superficial dark layer of muscles extending from sit bone to sit bone and from the pubic bone, we can think about this muscle group as your urogenital triangle. And this superficial layer of muscles is responsible for the function of ejaculation, erection, as well as urination. So any symptoms that you might be experiencing in these realms could be due to these muscles. And if we look a little bit deeper here at the pelvic floor muscles called your levator ani, this layer of muscles is mostly responsible for assisting with defecation as well as pelvic organ support. In general, these muscles can develop tension for a number of different reasons. It may be due to prolonged sitting, excessive straining with bowel movements, or even excessive loading and lifting during exercise. For more details on anatomy and causes of genital pain, please visit our recent YouTube upload with our co-founder Liz on the most common causes of penile pain. In general, all muscles crave blood flow and movement, so enter yoga. Full body movements combined with deep breathing maximizes motion in your pelvic floor and helps you to alleviate built-up tension in this area. Another main reason that yoga can be so therapeutic in the case of pelvic pain is because it impacts your nervous system and shifts you out of the fight or flight response that can occur when your body is in pain. Yoga can help you break this cycle by helping you tap into your own ability to relax and calm your body and your mind and ultimately alleviate tension in the muscles. So let's get moving and breathing together. Begin by reclining onto your back with either blocks or a strap nearby. If you're choosing to use the strap or a dog leash, create a loop with the device, and a loop that is a little wider than your shoulders, as seen here. And placing that strap around the knees so that it's touching the shins and the thighs, and as you bring the soles of your feet together and the knees out wide, let the strap support you in terms of keeping the feet close to the body and allowing the legs to drop into the support of that strap. Now, if you're using blocks, placing the blocks under either knee to similarly support the legs and allow you to relax into the butterfly position here. As you settle in with whatever props you have chosen, begin to deepen your breath. Inhale through the nose and exhale through the mouth. Begin to feel this 360-degree motion of expansion in your rib cage as you inhale. And on your next few breaths in, see if you can feel that expansion all the way down into your pelvis when you breathe in. Visualizing inhale to expand almost like a balloon inside your pelvis. Exhale back to neutral. A few more times like that. Big full breath in, filling up with air. And exhale to release. Notice the gentle stretch on the inner thighs here. And take one final breath before removing the props. Setting the props off to the side, we'll come into a squat stretch or a happy baby stretch next by grasping the legs at the shins, hugging the knees in towards your body. Check the screen for photo modifications of different grip positions for how to hold your legs, either behind the knees or at the shins. And if holding the legs is too much for you, see the modification where you can put the legs or feet on the wall for support in this way. But in general, working to feel a stretch in the groin here, near the pelvis, as you hug the knees in. Continue with your deep breathing and potentially rocking the pelvis side to side to get a little lower back release. And then softening into stillness again, breathing deeply, feeling that expansion in your rib cage. The diaphragm descends as you breathe in, and potentially you feel the pelvic floor muscles also as you breathe. And now we'll move on to windshield wipers. So bringing the knees down, setting the feet on the floor, and letting the knees drop side to side here. Just getting a little bit of massage on the glutes, a little bit of rotation in your lower back. Just noticing how you feel in the mobility of your hips side to side. And then we'll begin to be in a more of a still position here. Bring the feet a little bit wider now than the body, and then let the legs drop over to one side completely. And you'll feel a stretch along the inner thigh of the side of your body that is closest to you. And as you breathe here into hip internal rotation, just notice any restrictions that you're feeling, certainly modifying the position of your feet as needed. You might even feel this in through the quadricep muscle, the top of your thigh as you breathe. And take one more nice full breath here and switch sides. Keeping the feet nice and wide, dropping the knees over, and now letting the opposite leg rotate internally. Adjusting the feet as needed, but finding stillness here as you breathe. And creating better mobility through the hips ultimately helps to create better mobility in your pelvic floor muscles. Breathing here. Letting your body weight be supported by the floor. And then when you're ready, back to neutral. Next, we'll come into a side body stretch, taking your right foot, threading it underneath your left knee, and reach your left fingertips for your right foot here. And you'll come into a quad stretch as well as a hip flexor stretch on the right side. Breathing into this stretch first, and if you'd like to add on, you can certainly reach the right arm up overhead as you shimmy your shoulders to the left. And here you should feel the stretch all the way from your right knee to your right pinky finger. And potentially noticing as you breathe more deeply, the stretch also increases through the abdomen and the waist. Allow the breath to ultimately guide you into this stretch and deciding for yourself what intensity you'd like. Certainly backing out if you feel like it's become too much. Noticing what the body needs today. Take a few more breaths here. Notice how you feel this stretch in different areas of the trunk, maybe in the armpit, the shoulder, maybe the rib cage and the waist, or maybe the hips and the leg. Wherever the sensation is the most, see if you can direct your breathing right into that space of restriction or sensation. Feeling that expansion as you breathe, and the exhale to release and soften through the body. And as you breathe, notice any changes before you come out and switch sides. Back to neutral, unwinding the body, coming through the middle before threading the opposite foot underneath the knee. So left foot goes under right knee, reaching your right hand for your left toes. Initially feeling a stretch in the front of your hip, maybe into the thigh. And then when you're ready, ultimately you will potentially bring your arm up overhead if that feels right for you. Certainly backing out and coming back to this starting position if this feels better for you. And then maybe exploring that overhead position, reaching the body, letting the shoulders come with you as you create that nice long line of tension between your left knee and your left hand. Noticing where you feel the stretch on this side, and potentially it's in a little bit of a different place than it was on the other side. Simply observe and notice this. And continuing to breathe deeply here, feeling that expansion on the inhale and the release on the exhale. Again, allow your body weight to be supported by the floor. And as you breathe, reminding the physical body that these stretches are offering nourishment and release for your tissues. And then unwind from there, coming back through the middle. I'm just pausing here to finish our practice for about the next 90 seconds or so. We're going to be in a constructive rest position here on your back with the knees bent and the feet flat. Certainly grabbing a head support if that feels good for you. But in this position of constructive rest, the abdominal muscles and the hip flexor muscles have a chance to be completely relaxed and fully at ease here. So allow yourself to breathe deeply into your belly and keep the belly really soft and relaxed here. See if you can lengthen your exhales as you breathe out, seeing how long you can extend your exhale. And exhales, when they're lengthened, can ultimately trigger the relaxation response in your body. So even if you're driving along in the car, you can extend your exhale and still have a positive benefit for your nervous system. As you continue to breathe here, feeling that expansion through the ribcage and belly, see if you can feel the inhale all the way down into your pelvis. Visualize your breath moving down your spine and into your pelvis as you breathe. Take a final breath in through the nose and out through the mouth to finish practice. Well done.
Thank you for watching, and thank yourself for following along. The more often we create space for relaxation and ease in our bodies, the more we really start to rewire our nervous system, and our body then follows along. Be patient with yourself while you build practices that relax your body and mind and ultimately gear you towards a state of healing and recovery. If you'd like to work with me one-on-one to find the best stretches to fit your body's unique needs, find our virtual services tab on our website called Therapeutic Yoga, and our website is pelvicpainrehab.com.
Keep in mind, pelvic floor physical therapy is the first-line treatment for male pelvic pain disorders. Find a provider near you or reach out to us on our website or via social media. Thanks so much for showing up again, everybody. My name is Melissa, and I'll see you again soon.